What should patient know about colon cancer?
So again, colon cancer is a fairly common cancer. It's within the top 10 in both men and women in India. In men above the age of 50 years, it's very common actually. So what is important to know is there are three types of colon cancers, if I can say. What is called as a right side colon cancer, left side colon cancer, and a rectal cancer. These three behave differently. So symptoms are according to that. So if patient suddenly has a drop in their hemoglobin, if they are found to be anemic and they require multiple transfusions, and despite that they are anemic, on evaluation many a times we find that they have a right side colon cancer. Otherwise their appetite will be normal, they will be passing normal motions, there will not be any obstruction, vomiting, no symptoms apart from that. But it helps to have that bent of mind to evaluate for that anemia, for which the patient has to go visit the doctor. You have to go and seek help for that. That is one thing. The other thing is the left colon cancers. Left colon cancers usually cause obstruction first. So if recent onset past 3-4 months, the motions are abnormal. Previously you used to go once a day, now you are going 3-4 times a day. After that also you still feel like you are not comfortable, something is uncomfortable, you still like passing through, you should get it evaluated. The last is the rectal cancers. Rectal cancers typically present like I went to pass motions, after motions I am not happy. I still feel there are motions there but it's not coming out. This is the classic history with the rectal cancer patients talk about. You may or may not see blood in the motions. I mean, we all are, most of the people are using Western commodes right now. So nobody actually sees blood over there. Traditionally with Indian latrines, people were able to see that. So that is a challenge at times. But if you see blood in the motions, it is never good. Wherever the tumor is. So that is another symptom which helps to identify. So this is primarily what you should look in your symptoms and immediately seek help. The biggest challenge that I find is that patients do not want to undergo colonoscopy because it's uncomfortable. But you have a risk of missing a cancer and losing a life by not doing colonoscopy. So you should always listen to what the doctor says, and if it's advised, go ahead and get it done because you can be life-saving. Your thoughts?
As per the symptoms well covered. So to add up here, even colon cancers come with an element of genetic disposition. So we have many varieties of hereditary colon cancers. So even precancerous lesions, something called as polyposis coli, solitary polyp and all that. So as Sir was rightly saying, colonoscopy is one of the best time-honored technique that would identify any of these lesions. Let us say someone detects a polyp within a colon in some person. It is not always necessary that it is a cancerous lesion. Yes, but such a lesion is tagged and the person is asked to come for a follow-up. So on one such follow-up, if something is detected there in such a lesion, and if nipped off at the earliest, definitely the outcomes would be good in terms of patient cure.
To add to that, it's a very valid point. Most of the colorectal cancers arise from polyps. So if they undergo colonoscopy and identify polyps and they are able to remove it with colonoscopy, you are preventing a cancer. You are preventing that patient from suffering a cancer before it occurs, because a polyp converts into precancerous and then becomes a cancer over years. It takes years. So if you are able to tackle it early, we are actually avoiding the patient from undergoing the three main forms of surgery, chemo, radiation by doing that. So it's a very relevant and very useful point.